Hi, my name is Catherine Crace. I'm a lawyer, social worker, educator, and ethicist, and I'm here today to talk to you about the basics of professional ethics and talking about the four principles. Each year, I train tens of thousands of mental and physical health professionals on their ethical obligations. And in most of my trainings, there are professionals from various professional groups. Every professional group has a slightly different code of ethics that defines that profession's responsibilities. Instead of getting into the details of each individual profession's specific code of ethics, I ground my trainings in the understanding and application of four basic principles of ethics: beneficence, non-maleficence, autonomy, and justice. These four basic principles come from the ethics of medical and physical health professions, but are easily translated for use in all professions, including mental and behavioral health. Let's first talk about beneficence. The primary ethical principle of all professions is beneficence. The principle of beneficence is grounded in the idea that a professional's primary purpose is to do good or benefit the client. For mental and behavioral health professionals like me, it's easy to understand the beneficence principle. We come into our work so that we can help others and make their lives better. Let's distinguish non-maleficence from beneficence. Non-maleficence relates to the professional's obligation to minimize harm to the clients, patients, entities, and communities they serve. The word non-maleficence literally means don't do bad things. Not doing bad things almost sounds like the same thing as doing good things or beneficence, but it is not the same thing. The ethical principle of non-maleficence requires professionals to acknowledge that everything they do to help or benefit their clients comes with the risk of harm to that client or others that must be ethically minimized. Physical health professionals understand this obligation implicitly. It's embodied in the portion of the Hippocratic Oath interpreted as "first, do no harm." Medical professionals understand that every medication, every surgical intervention, etc., comes with the risk of harm. They shouldn't provide that intervention to a patient unless the chance of benefit outweighs that risk of harm. Mental health professionals, on the other hand, struggle with the concept of non-maleficence in their practice. Mental health professionals often assume that since everything they do is based on their intention to help, that they can't possibly be responsible for any resulting harm. And that's where they'd be wrong. Every intervention offered by a mental health professional comes with at least a risk of harm. Think of it this way. The clients of mental health professionals are not likely to be seeking their services because everything is great in their lives. And there aren't many clients who would claim that their work with a therapist or other mental health professional was always fun or enjoyable. In fact, the work with our clients can cause them to stress, trigger trauma, and destabilize interpersonal relationships. We risk these negative effects for our clients in the hopes that the ultimate outcome of our work will be worth it, that the benefits will outweigh the risks of harm. But it is our ethical duty, in fact, to conduct that assessment. Professionals should support autonomy. All professionals have the ethical obligation to support autonomy. Autonomy is related to the right to make decisions. Patients and clients should have the right to make decisions about their care and services that they receive. In order to support the making of informed decisions, professionals are ethically bound to explain to their patients and clients their options. We call that informed consent. Professionals also have the right to autonomy. Professionals are not like other workers in society. Some workers in society are bound by specific procedures. For instance, baristas at a coffee shop are bound to provide to the customer what the customer asks for and pays for. If a customer orders a half-calf latte with oat milk, the barista can't expect to be paid if they provide the customer with a cup of green tea, right? Professionals, however, are expected to provide their clients and patients with options. They can make suggestions about what's the choice they recommend for the client, and if the client refuses to agree with their suggestions, the professional doesn't have to continue working with that client. In fact, clients seek out the work of professionals specifically for their expertise and recommendations. Professionals should do whatever they can to support a client or patient's right to make decisions for themselves, whenever beneficence and non-maleficence would support such a choice. And professionals should support the right of other professionals to make decisions for themselves as well. Now let's talk about justice. The ethical principle of justice relates to equity and fairness. Justice is not the least important ethical principle. In fact, it is arguably the most important ethical principle. I discuss justice after introducing the other three principles of beneficence, non-maleficence, and autonomy for a reason. You cannot appreciate justice, nor be able to identify injustice until you recognize all clients, patients, entities, and communities that we as professionals serve deserve our beneficence, non-maleficence, and support of their autonomy. Then, if you see that certain people, groups, or communities are not getting access to those principles, then we know there is a concern for justice that we must attend to. Let's use these principles in practice. The law in all states provides that children have limited rights over the decisions made for their physical and mental health care. But that doesn't mean we should ignore their right to beneficence, non-maleficence, and even autonomy. Take this example. A 12-year-old is working with a therapist due to a history of self-harm. In the state in which the child is receiving therapy, the parent has the right to access the child's mental health records. After 6 months of therapy, the parent doesn't think the child is better yet and demands the therapist's notes. The child is nervous that the parent will see the notes about negative feelings they expressed about the parent to the therapist. The parents have the legal right to access the child's record, but the therapist has the ethical obligation to minimize the harm to the child that would come from sharing those records. The therapist can explain to the parent that their concerns are understandable, but that sharing the records might actually cause stress on the child that will result in regression of achievement made through therapy. However, if the therapist is unable to convince the parent otherwise, they will need to provide the notes. In that case, the therapist should do whatever they can to minimize the harm from that disclosure. The situation's not uncommon, but it is easier to avoid when the therapist effectively works with the family at the start of the clinical relationship and regularly to set expectations for disclosure and record sharing through the informed consent process. Let's talk about another example, mandated reporting. The law in all 50 states requires certain professionals to make reports to Child Protective Services when they meet a legal threshold related to their suspicions. We call this mandated reporting. Let's evaluate mandated reporting using the 4 ethical principles. Beneficence. The beneficent intent of mandated reporting is to identify and protect children experiencing or at imminent risk of experiencing child abuse or neglect. However, there are many harms caused by mandated reporting that are arguably not outweighed by the benefits. For instance, more than 2/3 of all reports that are investigated fail to find evidence to substantiate the report. As a result, more than 3 million families and children are subjected to intrusive and traumatic investigations and CPS involvement every year. 3 million! That is why mandated reporters are ethically obligated to only make reports when they are legally necessary. When a report is not legally mandated, it causes unnecessary harm to children and families. There's 2 kinds of autonomy for us to consider here: parental autonomy and professional autonomy. Parental autonomy relates to the fact that mandated reporting limits parental autonomy over their children and families. Every call to CPS means that parents will be forced to provide private information about their family to the government, even though fewer than 1/3 of those reports will result in services to a family. And then there's professional autonomy. Since the law requires these professionals to make reports, professionals lose their right to choice. There are many situations where a professional mandated reporter believes that they could help the family more than any Child Protective Services intervention could, but the law requires them to make the report. And then there are serious considerations for justice. Poor families and families of color are disproportionately reported to Child Protective Services by mandated reporters. Research suggests that these families are overreported in part due to implicit and explicit biases held by these professionals. Additionally, research shows that white families and families of higher socioeconomic status are less likely to be reported because mandated reporters fear repercussions from those communities that would impact the professional's livelihood. So professionals should use these 4 basic ethical principles to evaluate tough choices. You can use them at any point in your practice, and you can use them to clarify the easy choices that you make on a regular basis. For more information, resources, and training opportunities, check out www.makingthetoughcall.info. Thank you.